White House officials today insisted they've met their self-imposed deadline to fix healthcare.gov, and they claim the site is working smoothly for the majority of users. But not unusually, the facts suggest otherwise. I'm Lou Dobbs. Good evening, everybody. The Obama administration official in charge of fixing the Obamacare site, Jeffrey Zients, says there is a, quote, night and day difference between the healthcare.gov site that launched on October 1st, or tried to, and the one working today, or trying to. According to the White House, a 5-week technology surge has doubled the site's capacity. They claim it can now handle 50,000 consumers at the very same time. But there is more than considerable skepticism about anything the White House has to say about healthcare.gov, and with some good reason. This is the page that came up when our colleague, Fox News correspondent Peter Doocy, logged on. A page of gibberish filled with question marks. And it's not just frustrated consumers. Insurers say they're still dealing with an Obamacare mess because functions of the back end of the Obamacare system haven't even been built yet. And that means the administration's goal of enrolling 7 million people by the end of March, well, that could be just the latest in what has turned out to be a string of second-term failures for this president. Fox News Chief White House correspondent Ed Henry has more on what is actually different about healthcare.gov.
President Obama's aides struggled today to explain whether they really met the deadline to fix healthcare.gov after consumers reported getting a new page telling them there's so much traffic they've been thrown into a queue to wait, which the White House insists is progress.
I think you're confusing error messages with the queuing message, which is quite a different thing entirely.
It was only yesterday the tech team led by Jeffrey Zients claimed victory in meeting the November 30th deadline, saying the site was doing so much better that the queuing system was not needed Sunday.
The site has been performing well in terms of response times and error rates, and no, there has not been a need to deploy the queuing system at this point.
With a surge of about 375,000 users logging on Monday, errors and response times increased. So Carney explained consumers were placed in the queue and told to come back at a better time.
This day.
Goal then? Just keep moving them into other lines? I mean, the goal is obviously to enroll more people, right?
Absolutely.
And so if they're still
those people
waiting,
who want to enroll. Ed, I would point you to the fact that more people are visiting the site and are able to effectively go from beginning to end when it comes to enrolling than was the case in October and in November.
Yet insurance companies put out a new warning that the back-end systems of the site meant to deliver consumer information to insurers are still not ready.
What everybody wants to avoid is a situation in which consumers think they're enrolled, but their enrollments weren't able to be processed, they weren't able to pay their first month's premium, and their coverage actually isn't beginning on January 1st.
Kathleen Sebelius, the Health and Human Services Secretary, issued a desperate plea, writing in USA Today, quote, "To those Americans who have experienced difficulties online, please do not give up. The new marketplace is an opportunity for individuals without employer insurance to obtain coverage, with choice and competition that was previously unavailable." Though the administration's own progress report on healthcare.gov stated, quote, "The team is operating with private sector velocity and effectiveness," raising questions about whether the administration can turn the corner.
That is an acknowledgement that, you know what? If this was a government operation for a long time and it failed, now we're bringing in the private sector folks. I mean, that is an indictment on the whole idea of government as a solution, frankly.
So the administration took a bit of a victory lap this weekend about healthcare.gov, but the question tonight is whether online users are simply being moved from one waiting line to another. Lou?
Ed, thank you. Ed Henry. The Obamacare website's problems, particularly embarrassing today of all days, Cyber Monday, a day when millions of people log on to buy virtually any product or service from thousands of websites operating in the private sector. Healthcare.gov's measly numbers dwarfed by online retailers. For example, Amazon.com can handle 2.7 million visitors per day, or 80 million per month. eBay gets 4 million per day, 120 million per month. Even kayak.com gets more than 50,000 visitors per day.